In a modern and fast-paced world where everything, including most necessities and indulgences, are conveniently at hand, Americans are struggling to fight an obesity epidemic. By the year 2010, 36 states had obesity rates of over 25%. Many are now turning focus towards supplemental fasting as treatment for obesity. Some noted benefits of such fasting may include reduction or normalization of blood pressure, reduced insulin requirements, and consequently reduced need for exogenic insulin for type 2 diabetics. Previous studies have examined eucaloric ketogenic diets. However, it is important to note the effects of ketosis on capacity for endurance exercise during hypocaloric intake to fully understand and advance such weight loss programs. For this study, 6 slightly to moderately overweight, untrained volunteers were admitted to the Clinical Research Center of the University of Vermont College of Medicine for the 8-week period of the study. Their diets were then broken into 2 time intervals. First, there was a 6-week baseline period wherein the subjects were fed a eucaloric diet providing 1,400 kilocalories. Of this, it was broken into 45% of their energy from carbohydrates, 40% as fat, and 50% as protein. Which was therefore changed to include a 1.2 grams of protein per kilogram of ideal body weight per day. This was supplemented with potassium through bicarbonate, vitamins, and iron. The following measurements were taken during the duration of this study.
The results of this study show that prolonged exercise at 60% of VO2 max can be sustained in the absence of dietary carbohydrates for 6 weeks. This is most likely due to the switch from carbohydrate metabolism to lipid metabolism, as shown by muscle glycogen levels and respiratory quotient. There was no depletion in muscle glycogen with over 4 hours of uphill walking. This is in contrast to previous studies looking at muscle glycogen in non-fasting conditions. Resting muscle glycogen increased over the course of the fasting period, with 57% of baseline levels seen at week 1 and 69% of baseline levels seen at week 6. Respiratory quotient significantly decreased from 0.76 during baseline testing to 0.66 at week 6. Blood glucose levels were maintained throughout the fasting period. The severity of this RQ decrease was explained by an overall increase of ketone use as fuel, a decrease in overall CO2 production, as well as a loss of ketones, acetones, and acetoacetate via urine, breath, and blood reactions. Throughout the testing period, participants maintained healthy blood levels. Overall, participants lost an average of 10.6 kilograms of weight per person over the 6-week period. 67% of that was attributed to fat loss, and the remaining 33% was attributed to water loss, making this an effective weight management program.
We need another 20 seconds.